Susanne Kimeswenger from the Institute of Dermatology and Venerology, and I guess we're gonna get a bit of a medical.
Little bit medicine, little bit informatics, actually.
Wonderful, wonderful. Go ahead, please.
Okay, thanks for the nice introduction. So, yeah, welcome everybody to my little lecture today. My name is Susanne Kimeswenger. I'm working at the Institute of Dermatology and Venerology of the JKU. And I have to put this somewhere. So, and the focus of our lab is on the one hand on deciphering the mechanisms behind the pathophysiology and the therapy of rare diseases. And on the other hand, we also have a focus on AI/machine learning/neural networks, which I abbreviated like that, and here in dermatology. And that's what I will talk about today. So when you want to apply machine learning in dermatological research, you can use a lot of different data for that. On the one hand, you have images. As the skin is so accessible, everybody can take images of the skin, of lesions, of rashes, or whatever. And at the moment, this already has been done a lot. And there are even apps available that are approved as medical products, which let you take a picture of a nevi, and then will give you back the probability of this nevi being a malignant melanoma, which is really nice. But you can also use other data like omics data, RNA sequencing data, proteomics data, clinical data, like age, gender, blood parameters, and so on, or also medical images. So, for example, MR images, sonographic images, or histopathological images. I want to explain in short what that is. So, histopathological images are if something is excised from your body by a surgeon, or you get a biopsy of the skin, this will go to pathology, and there they will create very thin slices of the tissue and put it on a slide and stain it so that each cell is visible for the pathologist and he can make a diagnosis. And this is actually the kind of images we are working with. And then you can predict also different things. The straightforward target is to predict the disease or the outcome of a disease, but you can also predict survival time, whether a patient will respond to a small molecule drug or not, for example, when an onset of flare will happen for atopic dermatitis, for example, neurodermitis, the tumor entity, or also more specific things like protein expression or mutations of a tumor or a tissue. And as I said, we are working with histopathological images, so we are dealing with digital pathology, which means that these sections are scanned and then processed in a digital way. And machine learning is used a lot in this field because these histopathological whole slide images, as they are called when they are scanned, need real specialists to be diagnosed, and it's really hard to get well annotated data, and there are not a lot of good pathologists in different specialities around. So if we use machine learning for that, we can reduce the need of domain knowledge, and deep neural networks at the moment can really learn meaningful features without knowing anything about the section. Not even which staining or whatever has done with it. They just need to know, need to see the section, and they need, of course, to know the target. That is mainly the diagnosis. And that's one of the challenges in working with whole slide images, because there are not a lot of annotated data around. Again, because there are so few people who can annotate them. As compared to normal images like cats or cars, everybody can say that's a cat, that's a car, but for the histopathological images, we really need experts for them. And the second challenge is that they are really huge and not so easy to process with computers. So the goal of computational pathology is to optimize the clinical workload of a pathologist. That means we do not want to replace a pathologist, but really want to help a pathologist in saving time and also making better diagnoses. That's an example of one of these whole slide images, and as you see, it has really 15 billion data points to process for only one image, so it's really huge. And our projects aim at developing interpretable machine learning methods for dermatology. So that means that a pathologist or dermatologist should not only get like a diagnosis out from the machine or from the computer, but also he should know why the computer, based on which features, based on which parts of the image, the neural network did this decision, because he has to trust in the network, because he or she will be the person who is responsible for the patient in the end. And the second aim of our projects is to create well-annotated datasets that are also published and can be used by the community to develop different kinds of machine learning methods. So more specifically, we have 2 projects at the moment in this field. One aims at diagnosing basal cell carcinomas, BCCs, in whole slide images. And the second one aims to diagnose rare diseases in whole slide images, specifically cutaneous T-cell lymphomas. And as you see here, while for medical research, in deep learning, there are a lot of publications and a lot of work is done. For rare diseases, there is pretty less around, so that's also one reason why we focus on that. To project 1, this was, part of it is already published. It was a proof of concept project. We wanted to break the an otherwise straightforward task to predict whether a basal cell carcinoma is in a section of normal skin. So that's pretty easy for pathologists. But we wanted to know whether a neural network is able to see this tumor type in a whole slide image, and also if the neural network can do it in an interpretable way. So that's the architecture of our neural network. We had to tile the whole slide images because it's not possible to process the whole image at once with the neural network. That's the architecture. And then we get out of it a classification whether there is a BCC or not. And also on top of that, a so-called attention matrix, which gives us back the most important parts or tiles of the image that were used by the neural network for the classification. And we were able to curate more than 800 whole slide images for our data set, and our neural network was able to predict BCC or non-BCC with an accuracy of 95% and an AUC of 0.99, which is pretty good. We also, as I told you, got this attention matrix out of the neural network, which exactly shows the pathologist which of the parts of the whole slide image were important for the diagnosis. And besides this map, the diagnosing doctor can also have a look specifically at the most important tiles. So these are the examples for the 10 most important tiles of 3 different BCCs, and these are examples for the 10 most important tiles of normal skin. We also wanted to know whether pathologists and neural networks have the same features that they look at for diagnosing, and so we carried out an eye tracing study with pathologists, and as you already can see, the eye traces of the pathologists are pretty different to the attention map of the neural network. And that's another example of normal skin. We were able to quantify that with the Jakar index, which is a similarity measure, and we were able to show that the similarity between the attention matrix of the neural network and the eye traces of the pathologists is significantly lower than the similarity of the eye traces between the pathologists. So there are differences. We also were able to find several qualitative differences between neural networks and pathologists. And to conclude with that project, we showed that neural networks can distinguish between BCCs and non-BCCs with a very high accuracy in whole slide images, and that the neural networks focus on at least partly different patterns and structures than pathologists would do. The outlook for this project which is at the moment also funded by the European Academy of Dermatology and Venerology, is to increase the data set to include more different diagnoses, not only PCC, because as I told you, that is not so difficult, but also all available dermatological malignancies, including rare malignancies. And we want then to apply more advanced methods to this new, bigger data set and also make the classification faster. And later we want to predict other targets, like whether a tumor has a mutation or expresses a certain protein. And the second project that is very at the beginning, I would say. It's a cooperation project with the University of Lausanne, with Emanuela Genova. And here we work with a rare dermatological malignancy, cutaneous T-cell lymphoma. And the problem of that is that it is very hard to distinguish from inflammatory skin diseases in its early stages. But on the other hand, it's really important to diagnose it in its early stages because only then it can be treated well. So we hypothesized that machine learning can help to predict whether a lesion is inflammatory or malignant. For this project, we have a huge, for this kind of data set of almost 300 whole slide images, including very long-term clinical data over mostly 10 years at least. And we use different machine learning methods for predicting different things. So on the one hand, we want to predict the diagnosis of the CTCL patients or whole slide images. Then we want to predict the diagnosis based on histological images and also in clinical data. So we combine different data types for the prediction. But also we want to predict the clonality of samples. That means whether a T cell is clonal in a specific lesion or not. And also the course of disease and the survival only based on histological images. Very preliminary results show us that a neural network can predict better than average based on only whole slide images whether a lesion is malignant or inflammatory, which we can see here. So what is the future of AI in dermatology? I think in general, AI can make people really aware of lesions, and maybe also it's much easier to take the smartphone and make an image of your mole if you're not sure if to go to a dermatologist or not. And also it can help people in regions where there's not so much medical care around to decide when it is really necessary to find medical help. And in our group, the aims are to improve the availability of whole slide images for the training for the ML community, and also to improve the diagnosis of rare dermatological diseases with the help of AI. So with that, I want to thank my group, the head of our department, Professor Hötznecker, who is very supportive with these projects, the two students, Antonia and Ita, who are working on the projects at the moment, our collaboration partners at the Institute for Machine Learning and Pathology of the JKU, our collaboration partners in Vienna, and specifically also Emanuela Genova, who is really important and supportive for the CTCL project. And with that, I want to thank you for attention.
Thanks so much also for this last and final talk. Thank you for all three speakers, for that matter. It was a very exciting lit lecture, at least for me. At the very end, it's always my pleasure to announce the next LIT lecture, which is the 18th of January, 1 o'clock. Also here, I think we'll continue this sort of hybrid format, but if not, you will be informed. And I don't see the slide here, so I just basically announce it. So there's a new kind LIT call coming out, or lift C call, that's in preparation, where the focus is on transformational change. So very much in theme with what we have been going on here. It's funds that are being supported by the university that addresses all areas of the university, so nobody should feel excluded, quite contrary. And apparently the deadline will be roughly end of 2022, so it's pretty soon. I'm really surprised, but maybe beginning of 23, I would prefer that. Whoever is listening in maybe can make that happen. For 200,000 euros, 24 months, this is quite some nice seed money to get something started. Mario mentioned beforehand that that can go a long way in getting a new interesting idea out there. With that, thank you so much for attending this lecture, and I invite everybody to come by for coffee and cake. For those who are online, please come over. Thanks, bye.